Bacterial vaginosis. Let's have an introduction to bacterial vaginosis. Bacterial vaginosis is a common condition that occurs when there is an overgrowth of bacteria in the vagina. This can cause symptoms such as a fishy odor, discharge, and itching or burning. Bacterial vaginosis is caused by a disruption in the normal balance of bacteria in the vagina, which can occur for a variety of reasons, including sexual activity, the use of certain types of birth control, and pregnancy. It is usually diagnosed by a healthcare provider based on symptoms and a pelvic exam and can be treated with antibiotics. Bacterial vaginosis is not a sexually transmitted infection, but having bacterial vaginosis can increase a person's risk of getting a sexually transmitted infection, but its causes can be linked to sexual activities. Signs and symptoms of bacterial vaginosis. The signs and symptoms of bacterial vaginosis may include vaginal discharge that is gray or white in color, with a strong, fishy odor. Vaginal itching or burning, pain or discomfort during urination or intercourse. Redness or swelling in the vaginal area. Vaginal bleeding or spotting outside of your usual menstrual cycle. A change in the consistency or amount of vaginal discharge. A feeling of discomfort or pressure in the lower abdomen or pelvis. A burning sensation during bowel movements. Swelling of the labia or vulva. An increase in a vaginal discharge after intercourse. Causes and risk factors of bacterial vaginosis. Bacterial vaginosis is usually caused by an overgrowth of certain types of bacteria, such as Gardnerella vaginalis, and a decrease in the number of beneficial bacteria, such as Lactobacillus, which are naturally found in the vagina in a critical balance. But if the number of these unfriendly anaerobic bacteria increases, they create an imbalance of microorganisms present in your vagina. The exact cause of the overgrowth of these bacteria is not fully known to scientists, however, there are some known factors that may increase the risk of bacterial vaginosis. Imbalance of vaginal flora. This can cause symptoms such as vaginal itching, discharge, and a foul odor. The exact cause of bacterial vaginosis is not fully understood, but it is believed to be caused by an overgrowth of certain types of bacteria, such as Gardnerella vaginalis, and a decrease in the number of beneficial bacteria, such as Lactobacillus. Risk factors for bacterial vaginosis include having multiple sexual partners, smoking, and using certain types of vaginal products, such as douches or scented soaps. Unprotected sex. Having multiple sexual partners. Having multiple sexual partners increases the risk of bacterial vaginosis as it increases the chance of being exposed to different types of bacteria. Not using condoms. Not using condoms during sexual intercourse can increase the risk of bacterial vaginosis as it allows the transfer of bacteria from one partner to another. Douching. Douching can disrupt the natural balance of bacteria in the vagina, making it more susceptible to bacterial vaginosis. Hormonal changes. Hormonal changes, such as those during pregnancy or menopause, can make the vagina more susceptible to bacterial vaginosis. Antibiotic use. Antibiotics can disrupt the natural balance of bacteria in the vagina, making it more susceptible to bacterial vaginosis. Multiple sexual partners. Having multiple sexual partners increases the risk of introducing harmful bacteria into the vagina, leading to bacterial vaginosis. Poor hygiene. Poor hygiene practices, such as not properly cleaning the vagina, can lead to bacterial vaginosis. Certain medical conditions. Certain medical conditions, such as HIV and diabetes, can make the vagina more susceptible to bacterial vaginosis. Using an intrauterine device or another contraceptive. Using an intrauterine device, IUD, or other contraceptives can increase the risk of bacterial vaginosis. Certain lifestyle factors. Certain lifestyle factors, such as smoking, can make the vagina more susceptible to bacterial vaginosis. Complications of bacterial vaginosis. A consistent bacterial vaginosis can lead to further complications including pelvic inflammatory disease. Bacterial vaginosis increases the risk of PID, an infection of the uterus and fallopian tubes, which can cause chronic pelvic pain, infertility, and ectopic pregnancy. Preterm labor. Women with bacterial vaginosis are at an increased risk of preterm labor and delivery, which can lead to serious complications for both mother and baby. Increased risk of HIV and STIs. Bacterial vaginosis can make it easier for HIV and other sexually transmitted infections to be transmitted. Recurrent bacterial vaginosis. Many women experience recurrent bacterial vaginosis, which can be difficult to treat and manage. Vaginal odor. Bacterial vaginosis can cause a strong, fishy odor, which can be embarrassing and affect a woman's self-esteem and sexual relationships. Vaginal irritation and discomfort. Women with bacterial vaginosis may experience itching, burning, and discomfort in the vaginal area. Sepsis. In rare cases, bacterial vaginosis can lead to sepsis, a potentially life-threatening infection that can spread throughout the body. Prevention of bacterial vaginosis. There are preemptive and precautionary measures, which can definitely reduce the risk of suffering bacterial vaginosis. Practice safe sex by using condoms or dental dams and limiting the number of sexual partners. Avoid using scented products, such as bubble baths, scented soaps, and douches, in the vaginal area. Keep the vaginal area clean and dry by wiping front to back after using the bathroom, avoiding tight-fitting clothing, and avoiding prolonged sitting in wet bathing suits or workout clothes.